This is ASU Reports. I'm Danielle Harris, Media Relations Specialist here at Augusta State University, and today I'm joined with Ms. Shannon Stephens, who's a licensed professional counselor and has worked here at ASU in our counseling center for 13 years. Thank you so much for being here with us. Now today our topic is women and depression. This is a very important topic because according to the American Psychology Association, they say that women are more diagnosed or diagnosed more with depression than men. So I think this is a very important topic.
Right.
So as we get into things, if you could, Ms. Stephens, explain what depression is.
Okay. Well, clinical depression is a type of mood disorder, and it's one of the most common mental illnesses that's diagnosed in America. It affects over 19 million Americans, so you can see how common it is. In terms of the actual diagnosis, this particular mood disorder includes major depressive disorder, the bipolar disorders, which is what we used to call manic depression, and also a type of depression called dysthymia, which is a milder type of depression but more longer lasting. So it fits in that particular category of mood disorder. And it's important to note that clinical depression is a true medical illness, but it's very treatable and has more than an 80% treatment success rate.
Okay. Now tell us who's affected by depression and what are some of the symptoms?
Okay, that's a great question. Anybody can be affected by depression at any time during their life. Men, women, children, adolescents, people from different ethnic groups, people with different medical and health conditions, so it can affect anybody at any time during their life. Depression, clinical depression specifically, is never a normal part of any part of your life or portion of your life, and it's a real medical illness that doesn't need to be confused with the typical having a bad day or having the blues or just feeling bummed out. It actually, to be diagnosed as clinically depressed, you generally have to meet 5 common symptom criteria, and those symptoms generally have to have been around for at least 2 weeks or longer. And a mental health professional or licensed physician will look at a whole grouping of symptoms in order to diagnose whether or not someone's clinically depressed. Some examples of some of the symptoms, since you ask about that, and it's really important for people to know what they are. The first symptom that most people think about is the sadness, and it's typically a very persistent sadness, an anxious mood sometimes, or very empty mood. A lot of times my clients will tell me that they just don't care about things anymore, and it just feels kind of empty and numb inside. And they just lose interest in things that they previously found very enjoyable or thought was very important to them. They'll typically report that they may have changes in their appetite, which may affect weight loss or weight gain. Sleep disturbances are common, and that can present itself in a lot of different ways. For example, a person may have a greatly increased need for sleep, finding that they're sleeping much longer than they used to, napping more often, or maybe they're having trouble sleeping at all, which might be trouble falling asleep, staying asleep, or waking up in the very early morning hours. You may notice irritability, anxiousness, difficulty concentrating or being able to focus on things. So that can have a major negative impact on your ability to perform your job or to be a good student. So it can affect a lot of different areas of your life. There's typically a lot of fatigue and loss of energy that might present itself with depression. And doctors and other mental health professionals will look at a whole picture of all of these symptoms together to see just how severe they are, how long they've been present, and how much they're negatively affecting a person's quality of life.
Okay. Are there any other symptoms that we need to be aware of?
Yeah, there's that other high-risk category that scares a lot of people, and that's where a person's perspective on their life can become very hopeless, feeling very helpless and out of control, maybe obsessively guilty or lots of regret over so many different things in their life. And a lot of times that hopelessness can lead to a person having thoughts of death, which is where the risk for suicide comes in. And this can range in severity from a person who has very passive thoughts of death, where maybe they think, well, I would just like to go to sleep tonight and not wake up tomorrow because I'm so miserable. And then you have that more severe category of people who may be actively seeking to take steps to end their life because their desire to end their life is just so strong because of the severity of the depression. And that's where a person may actually seek out the means to take their own life or actually attempt that. And since we are talking about women in depression, it's important to note that women do attempt suicide about twice as often as men, but men tend to be more successful with completing a suicide because they often use a more lethal means of ending their life than women do. So you can see how seeking out treatment early on is very significant, because when the risk is great and a person's in crisis, it can actually be a lethal situation where a person may end their own life.
Well, there's some myths, and one of them that comes to mind is postpartum depression. And I've heard that, you know, maybe a little while after you've given birth, of course, you may go through some type of depression, but you'll get through it on your own. So is that true, or should that female just go right ahead and seek medical attention?
Anybody that's experiencing any of the symptoms I just mentioned, whether you just had a baby or you're a male and that's not an issue, should always seek out immediate attention and let the treating professional make that determination of whether or not it actually is postpartum depression or some other type of clinical depression, instead of hoping it will resolve on its own, because the risk is too great, particularly in a postpartum situation, not only for the mother's well-being, but also for the child's. So the myths about women and it being a normal part of the reproductive cycle to maybe have clinical depression during menstruation or menopause or after you have a baby, those are myths. It's never normal to be clinically depressed, no matter who you are or what your health situation is. So seeking help is very important.
Okay. Let's see. Let's go right into our next question. What are the illnesses that are often found to coexist with depression in women?
Well, there are a lot of illnesses that tend to kind of coexist. For example, we know there's a strong link with women particularly being depressed and the presence of substance abuse, whether it be alcohol or other drugs. We know that a lot of women who experience eating disorders also suffer from clinical depression. And then there's also physical health conditions that tend to contribute to being vulnerable to clinical depression. Things like heart disease, stroke, diabetes, cancer. Those kinds of persons who are suffering from those illnesses tend to be more vulnerable. And in those situations, it's very important to treat both illnesses and not just assume because you're being treated for cancer or because you've had a stroke or you're suffering from diabetes to just treat the physical illness and skip the mental illness, as again kind of buying into that myth of it being a normal part of your functioning, which it never is.
So why do you think women are diagnosed more than men with being depressed?
Well, we know that women are diagnosed roughly twice as often as men, and when I say diagnosed, you have to be very specific about that. We don't know that women have depression twice as often as men. We can only go on statistics based on who comes in for help. And sometimes women do seem to be more open to seeking help and discussing their symptoms with other people, including professionals, doctors, and other mental health professionals. So that could be one reason. There could be a lot of other reasons. We're not far enough along with science to be able to say definitively that it's one thing or another. But one of the things that we do know can contribute would be those hormonal factors that we've already discussed. You know, the changes that happen in a woman's life based on a reproductive cycle could be part of it. It could be genetic. It could be that it runs in families. It could be cultural and social. You know, a lot of women are socialized and raised to be caregivers, and they take on a lot of different roles and tend to put themselves last over with their children or spouses or others coming first. So that could be part of it. We know that women tend to be sexually abused or at risk for that about twice as often as men, and we know that that tends to contribute to clinical depression. Other things to look at would be the changing face of the family in America. For example, women tend to be heads of household as single parents more often. They're raising children or grandchildren on their own. So they're trying to be successful in a career, trying to be a successful mother, grandmother, maybe trying to put together a blended family, which can be stressful. And trying to be successful in all those things and juggle that around sometimes is a struggle. You add in something like going back to school or caring for an aging or sick family member, and the vulnerability just increases. So even though we can't say for sure one specific reason why women are more vulnerable than men, those tend to be some of the common risk factors.
So what can we do to help someone who's going through depression?
That's a great question. As a non-professional, one of the best things a person can do is just be a supportive, non-judgmental, caring listener to try to encourage that loved one to seek treatment from a qualified professional. It's very important not to try and take over that person's life, because it can be very tempting when we care about somebody to want to fix it for them.
Right.
And it's not something we can fix for someone else. We can encourage them to seek out good treatment. We can try to educate ourselves on depression and understand that it is a true medical condition. It's not a character defect. And try to avoid saying things like snap out of it, or you'll get over it, or this will pass, because that tends to just frustrate the individual who is depressed. And it's also important not to take it personally if that person rebuffs your efforts to help, because that can just be another symptom of the depression where they reject your offer for support or for assistance.
And my last question is, what are some of the ways you can treat depression?
Okay. That's another great question, because we don't want to talk about this without saying, where the help is available, or encouraging hope in others. As I mentioned earlier, this is a very treatable illness, more than an 80% success rate, which is much higher than many other serious illnesses that people seek treatment for all the time. Typically, the more common treatments would be medication therapy with the use of antidepressants, and also talk therapy or counseling. Research tends to show that a combination of using both talk therapy and medication therapy tends to be the most successful, but that's not necessarily the case 100% of the time. There's a particular type of psychotherapy called cognitive behavioral therapy, which is an evidence-based therapy where there's good statistics to show that it tends to be very effective in treating depression. So those are some of the ways that you can treat it. In terms of where can you go for help, there's a lot of different avenues you can go for seeking out treatment. You can speak to your family physician about it and ask for recommendations for a qualified professional to see. Speaking to a pastor or other clergy member may be a good lead. Friends and family who maybe have sought treatment can give some good recommendations. We're very lucky in Augusta that we have a lot of good resources available. Just opening up the phone book in the Yellow Pages is a good place to look for licensed counselors, licensed psychologists, marriage and family therapists, psychiatrists. There are numerous listings there. There's a lot of good support groups in the area where a person can get help. A lot of those are listed in the local telephone directory as well. Local mental health associations and agencies, our local state-supported community mental health agencies, where it might be a little bit more affordable for some people to go for help. A lot of religious-based groups and churches offer different services and might be a good resource. And then online, there are a lot of good resources for where to seek treatment as well. So it's just important for people to know that there's a lot of help out there, regardless of what your financial situation is.
You don't have to go through this alone.
That's right. And it's very treatable. It's a real shame for people to suffer unnecessarily with this illness when it has a very high successful treatment rate.
So there is hope.
There is hope.
And I want to thank you so much again for being with us.
You're welcome.
And
Thanks for
if you would
having
like
me.
to learn more about Augusta State University, just visit our website. That's www.aug.edu. Thank you for tuning in, and thank you again.
You're welcome.